Hello, I'm Dr. Nadia Boutaoui. I have a Ph.D. in genetics and have been directing research in respiratory diseases for over a decade. I also have an MBA in healthcare. I wanted to do a series about COVID-19, and this video is about the basics. In this video, we'll cover the origin and the transmission of COVID-19, some statistics such as mortality rate and economic impact, preventive measures, as well as I mentioned here a fourth point about vaccines, and these will be covered in a separate video, so stay tuned. Science knows no countries, and knowledge belongs to all humanity. Science is the torch which illuminates the world, by Louis Pasteur. First, we'll cover the origin and the transmission of coronavirus. COVID-19 is an infectious disease caused by SARS-CoV-2, also known as coronavirus. It got its name from the spikes around the virus that looks like a crown. The outbreak originated in Wuhan, China in December 2019. The disease can be transmitted from person to person if a person who's sick coughs, and these droplets can get into another person. It can also fall on surfaces, and when somebody else touches those surfaces, then touch their eyes, nose, or mouth, they can become infected. These droplets, the very small ones, can stay in the air. This means the virus can be transmitted through the air, especially indoors. That's why masking up is very important. The symptoms include tiredness, high fever, dry cough, as well as difficulty breathing. It's important to note that asymptomatic people, meaning people without any symptoms, they can still infect others. You can still catch the disease from an infected person who does not feel ill. In fact, 80% recover from this disease without needing any special treatment. COVID-19 is an unprecedented pandemic with high mortality rate and a huge economic impact. Globally, as of December 14th, there were more than 1.6 million deaths and close to 73 million cases that are confirmed worldwide. The 10 most countries with mortality include Yemen with close to 30%, Mexico close to 10%, and the average mortality rate across the world is 2.25%. This table includes the 5 countries with the highest number of cases. Topping the list is the United States with over 16 million confirmed cases and close to 300,000 deaths, followed by India, Brazil, Russia, and France. The crisis has a huge financial impact across the world. Over 16 trillion losses worldwide. That represents about 90% of the United States annual gross domestic product, GDP. For prevention measures, we would still need to mask up, wash hands, and observe social distancing. Antibiotics do not work against coronaviruses. So to protect ourselves and loved ones and prevent the spread of COVID-19, we'll still need to keep washing our hands, keeping our social distance. Try our best not to touch our eyes, nose, and mouth, as well as covering our mouth and nose with bent elbow or tissue when coughing, seeking medical attention if you're having difficulty breathing or a high fever, as well as following up the directions of the national and local health authorities. If you have visited an infected area, please stay at home if you don't feel well. Mask up when you go out. Seek medical advice if you're having difficulty breathing or having signs of fever. And please call your provider and inform them about any recent travel and cooperate with the contact tracers. COVID-19 vaccines, including their types, efficacy, and safety, would be covered in a separate video, so stay tuned. You can follow me on Facebook at Dr. Nadia Boutaoui, also on LinkedIn and Twitter. Please share this video to spread the word, and thank you for listening.